Gynecomastia is a very rewarding portion of my practice here at Premier Plastic Surgery. Gynecomastia is a condition in men in which the male breast develops more predominantly, giving it a more feminine volume and shape. We see this condition of gynecomastia develop in men during their early years of adolescence, as well as in their later years of their 40s and 50s. When it develops in adolescence, it is often accompanied by a very self-conscious, ashamed feeling in the young male. This can be carried into the 20s and 30s, changing both physical behavior and social interaction. This is often under-recognized and under-treated. We see it again develop in the 40s and 50s, and this typically lasts throughout the rest of the man's life. Between 15 and 20% of males have some degree of gynecomastia, and they are often unaware of the ease and simplicity of its treatment and recovery. A new technology called ultrasonic liposuction has been used in recent years as the gold standard for gynecomastia treatment. Ultrasonic liposuction is different than standard liposuction because the energy disrupts and liquefies the breast tissue and the fatty tissue in the chest, allowing this to be more gently and more thoroughly removed from the chest. In the last 800 patients that we've treated, we find that between 5 and 7% of patients require an additional open incision to resect very fibrous hard tissue that won't respond to the ultrasonic liposuction. Through a small open incision in the border of the areola, we can excise this tissue, enclosing the incision with internal buried sutures. In an even smaller fraction of our patients, typically the older patient with excessive skin laxity, skin removal is actually necessary. Although the skin removal can be performed at the same time as this procedure, it's typically to the patient's advantage to do this secondarily at a separate setting for two reasons. Number one, the ultrasonic treatment itself greatly adds to the tightening and firming of the skin and often eliminates many patients from needing that skin to be removed. Secondly, if it does need to be removed, the skin is typically tighter and firmer and less needs to be removed, which helps us limit the incisions required for the skin removal. Recovery is rather rapid following gynecomastia treatment. Men can return to school activities, academic endeavors, and work activities within 3 days. Some younger adolescents may take a week off of high school or college, but typically older men will be back to most of their activities within 2 or 3 days. Your surgical treatment of gynecomastia will be performed in our Quad ASF certified surgery center. Under IV sedation or a very light general anesthesia, 2 small incisions are made in the breast, and through this fluid is placed into the breast, which will numb the breast up and distend the tissues to allow us to work more precisely at varying levels in the breast. Treatment of gynecomastia is a very rewarding part of my practice, for I myself have had the treatment and have enjoyed a dramatic improvement in my own personal and physical life. My only wish is that more men would learn of their options for the treatment of gynecomastia so that they too may realize a difference in their life. I look forward to meeting you and treating you following consultation.